we're looking at the anti-asthmatic drugs. So under the anti-asthmatic drugs, there is a class of beta 2 agonist as well as the anticholinergics. Next, there is the methyl xanthines, that is the theophylline as well as the aminophylline. And there is also a new PDE4 inhibitor approved for the COPD, and this is the roflumilast. Next, looking at the uses, the use is that it helps in the bronchodilation, and this is due to the adenosine antagonism. So here the PDE3 is greater than the PD4 block. It is also anti-inflammatory, and this is due to the PDE4 block. There is the histone deacetylase stimulation and an increase in the IL-10. Now we focus on the side effects. So under the side effects, in case of the adenosine block, so this can lead to the seizures as well as the arrhythmias and the diuresis. Next, in case of the PDE4 block, this leads to the GIT upset as well as headache. Next, we focus on the inhaled corticosteroids. That is, here the fluticasone. So this fluticasone is a very important, it is a most potent. And next we also have a soft steroids. So soft steroids is the cyclosonide as well as the beclomethasone. So now looking at the uses, it is a DOC for the persistent asthma as well as the treatment of choice in case of acute attack. So here it is ICS plus the formoterol. Next we look at the adverse effects. So in case of adverse effects, it can lead to the hoarseness of the voice, and this is the most common that is to be known. Next, there is also the oropharyngeal candidiasis. Then we look at the use of the systemic steroids. So the systemic steroids, the uses is that it is for the acute exacerbation, that is leading to the increased beta 2 agonist effect. Then we look at the LOX inhibitor. So the LOX inhibitor is the Xyluton and also the LTC4D4 inhibitor. So this is the montelukast. So what it does is it leads to the use is the persistent bronchial asthma. So here, to add on the EIA. Next, the adverse effect being it is hepatotoxic. Next, we move on to the MSC, mast cell stabilizers, MCS, that is mast cell stabilizers. So it includes the chromoline, sodium, as well as the nedochromyl. So the use being, it is used in case of the prophylaxis of allergen induced asthma. And looking at the adverse effects, it's a very safe drug. Next, we jump on to the anti-IgE, that is the omalizumab. So this omalizumab, the mechanism being, the use, it is in case of the severe persistent bronchial asthma. So what is the adverse effect? It is not effective in case of atopic dermatitis. So that is the adverse effect. Next, we look at the anti-IL-5. So in case of anti-IL-5, there is the reslizumab as well as the mepolizumab. Okay, and then we look at the anti-IL-5 receptor. So this is the benralizumab. Next, we look at the anti-IL-4 receptor. So this is nothing but the dupilumab. So what is the use? The use is, it is in case of the severe eosinophilic asthma.